Hi, everyone. Welcome to your November 2022 clinical practice update video. My name is Jen Bolster, paramedic practice leader within the Department of Clinical Governance and Professional Practice. Before I begin, I'd like to acknowledge that I join you today from the unceded and traditional territories of the Slia-Amon Nations, otherwise known as Powell River. I am delighted to say thanks and express gratitude for allowing me to work, live, play, and learn on these traditional lands. So we have a few clinical practice updates for you this month. To begin, we'll start with communities of practice. So as part of the Clinical Advisory Committee, it's been the intent to create license-specific communities of practice around the province to connect paramedics with each other to share in best practices. So community paramedics already have a well-established community of practice framework that connects individuals within their regions, and we really like to see that grow and extend to other clinical roles throughout BCEHS. So as we start to establish a framework in which to support communities of practice for clinical roles across the organization, we would like to hear from you and what you may already have within your regions, as well as gauging interest in facilitating sessions with the support of your leadership teams and accompanying materials. So we really want to make sure that this is user-led and led by paramedics themselves. So if you're interested in getting involved with a community of practice, or you have some ideas on how these may best be laid out, please reach out to clinicalpractice@bchs.ca and let us know what your license level is, what your operational scope of practice is, and what your region is. Next, we are elated to announce that the Substance Use SSC Treatment Referral Pathway Education course has now been released. This has been released with the tremendous effort of the Learning Department, as well as our department in advocating to get this education out so that paramedics can comprehensively and comfortably utilize this very important pathway. As a reminder, the substance use referral pathway is a very meaningful way for paramedics to reduce harm in the community at the scene of a drug poisoning event. On that note, I would just like to add that October of this year saw the highest number of substance use referrals to date from the inception of the actual pathway, with 18 referrals in the month of October alone. So well done, and huge thanks to everybody who is using this pathway. And as always, if you have any questions in how best to use this pathway, or if you have any feedback in the actual utilization of the pathway, please don't hesitate to reach out to myself, or once again, clinicalpractice@bchs.ca. And on to our practice reminders. In terms of language services, as part of our commitments to ensure equitable and accessible healthcare for patients across the province, BCEHS has taken several steps to provide communication platforms to employees that can be used to aid in their communication with patients. So last year, BCEHS was the first ambulance service in Canada to introduce video remote interpreting application for patients who are deaf-blind, and hard of hearing on all BCEHS ambulance iPhones. So this is the Insight app. The Insight app can be used to connect on demand to a video interpreter who can provide American Sign Language Services, or ASL, for patients, and other materials can also be found on the BCEHS handbook to support communication with these patients, as well as a resource sheet on spoken languages that can directly be accessed by calling the language line. This is a reminder for paramedics who are utilizing the ACP Thrombolysis clinical practice guideline on patient identifiers on the ECG. So this is a reminder that when you've identified a STEMI and will be transmitting the ECG, it is absolutely imperative that we can confirm that the ECG and the EPOS physician is viewing the correlated ECG. So this is to ensure patient safety. It's required that we enter at least 2 of 3 patient identifiers, being name, date of birth, and PHN, on the ECG prior to transmission. So the steps involved here after obtaining the 12-lead ECG is to push options, then patient, enter the last name and then the first name, enter the PHN under patient ID, enter your unit number, i.e. 122A1 or 122 alpha 1, under incident, and then transmit the ECG once the required information has been entered. Please use the patient identifiers when speaking with the EPOS physician to confirm that they are viewing the correct ECG. This will also help us in assisting in our QI process. We do recognize that this adds to the overall workload and appreciate your efforts to ensure patient safety. We have had 22 successful thrombolysis to date since this program was developed, and 4 successful thrombolysis since the expansion of the program. This is a reminder about the ongoing Royal Columbian Hospital cardiac arrest study. If you're not already familiar with it, the Royal Columbian Hospital is currently involved in a study which is looking at the effects of ketamine as a neuroprotecting agent in post-cardiac arrest care. So eligible patients need to have presented in a shockable rhythm at your arrival on scene and have ROSC at arrival at the emergency department. When you are providing your patient handover, please ensure that you highlight this information to the receiving team so that the patient can be appropriately enrolled into the study. And lastly, we have a practice reminder around entering patient age data into the EPCR. So when undertaking audits of the EPCR and data reports, we've identified an issue with EPCR data entry pertaining to age. So this is happening where a patient's age is being estimated and then inputted as days or months accidentally. So what this is doing is it's giving us false information about the patient's age, rendering them and representing them as a pediatric patient when in fact they actually are an adult. So we have found out that this issue is primarily user entry related. And so what we're reminding paramedics to do is when you are at the scene of a patient and for whatever reason you are unable to get their birthday, or they're not willing, or they do not wish to share their birthday, is to just please make sure that when you are estimating their age, you are ensuring that it says years and not days or months, so that they're being represented as an adult and not as a pediatric. We are working with the Siren team to look at implementing certain mandatories to prevent this error from occurring. But in the interim, please make sure that when you are estimating a patient's age, you are selecting years as their date in years when they are an adult patient. And you can also review and confirm this as part of your finalization in your clinical quality score using iCares. So that's it for the November 2022 clinical practice update video. As always, thank you for your continued dedication and efforts towards quality patient care and safety. We have some really exciting things coming. I'm sure you're all aware that there are some operational scope of practice announcement that will be coming out soon that we're all looking very much forward to implementing to ensuring that paramedics have the right tools and the correct tools to appropriately do their job and provide the best care possible. Outside of this, you may have noticed that BCEHS has some new governance structures and committees that you're seeing referenced in some BCEHS communications. So we'd just like to provide some clarification on what it is the Clinical Advisory Committee does. So this committee, the Clinical Advisory Committee, serves as a primary governance function and reports into the BCEHS Board of Directors and senior leadership on clinical developments. It approves and provides recommendations on clinical policies, initiatives, and practices across the organization, and is responsible for providing high-level oversight of clinical quality, education, patient safety, and standards and quality. So the Clinical Advisory Committee also oversees several subcommittees with a variety of responsibilities. So you may have heard of the Council for Excellence, the Pharmacy and Therapeutics Committee, or the Credentialing Committee. So the Council for Excellence supports and oversees quality improvement initiatives and performance measures. The Pharmacy and Therapeutics Committee provides guidance and oversight of medications and interventions for paramedics and emergency medical responders. And the Credentialing Committee develops, monitors, and maintains standards for education, training, and practice of clinicians at BCEHS. The Clinical Advisory Committee membership includes senior and executive program directors, paramedic practice leads, and medical directors for the various license levels, as well as representatives from QP 873. The committee meets every month, and minutes of its discussions and decisions are actually available on the intranet for you to view. Interested stakeholders, which can be individual paramedics, Teams within BCEHS or outside agencies can bring suggestions for change to clinical practice through their clinical operations team and clinical governance and professional practice team, so their clinical ops managers and their paramedic practice leads, for discussion. So working with one of these leads, stakeholders, which could be a paramedic, will develop a business case and implementation plan for the proposed change and present it to the Pharmacy and Therapeutics Committee for discussion, review, and decision to proceed. With a recommendation from the Pharmacy and Therapeutics Committee, a proposal will then be discussed by the Clinical Advisory Committee, where a decision is made for final approval and implementation across BCEHS. So these committees are intended to strengthen BCEHS's clinical governance strategy by providing clear pathways for both accountability and practice change as we move forwards to really build a better ambulance service. So what is really great about this is that you, as paramedics, are welcome to bring forward your ideas and suggestions for changes to clinical practice, working with your clinical ops managers or your regional or license-specific paramedic practice lead to bring these through the governance structures and potentially implement them into clinical practice. So if you have ideas or suggestions, or you are interested in bringing forward a change to clinical practice, please do reach out to your regional clinical operations manager or your regional PPL or license-specific paramedic practice lead, and we will be just delighted to work with you to bring these changes forward for potential implementation. Thank you again for watching this November 2022 clinical practice update video. As always, any questions, comments, concerns, or feedback, please don't hesitate to reach out to clinicalpractice@bchs.ca. Stay safe and see you next time.